Now let us talk about the chain of survival. The first line of chain of survival is activating your EMS. It is normal instinct of every individual that if they find somebody who needs help, they call for assistance. Number 2, once we activate our EMS, a high-quality CPR is needed. Remember, when you provide a high-quality CPR, it will increases the chances of survival. Number 3, in the chain of survival, is the provision of early defibrillation. As what I have said earlier, the most common cause of death for adult patient or adult individual is cardiac arrest. So early defibrillation is the treatment for ventricular fibrillation. Number 4 of the chain of survival is the advanced resuscitation. Advanced resuscitation is the time when your EMS arrives to the location. And number 5 in the chain of survival is the post-resuscitation care. This is the time where the patient or where the healthcare provider bring back spontaneous sign of circulation and the person or that potential patient has been admitted in the intensive care. And lastly, the recovery period, wherein the patient will be discharged from the hospital. Now, the most important part in the chain of survival is a high quality CPR, because the qualities of CPR that you provided will be depend or will judge whether it is a successful CPR or it is effective CPR. These two are two different things. If you say successful CPR, you're able to bring back spontaneous sign of circulation, such as breathing, coughing, pulse, return of consciousness, the person starts talking. But it doesn't mean it is effective. Maybe it is successful in a sense that you bring back all those spontaneous signs of circulation, but the person after recovery might end up in a vegetative stage, or he will not be able to return back to his normal way of living. So that is the way how you will evaluate if your CPR is very effective. It is effective when you bring back a spontaneous sign of circulation, and post-hospitalization, that person will be able to go back to his normal way of living. Your BLS algorithm, it starts from the time that you recognize the responsiveness, whether it is a witness arrest or unwitnessed collapse. So how you will going to check for responsiveness? Simply by tapping the shoulder and asking that person if he is okay. If you find that person is unresponsive, immediately activate your EMS. Once you activate the EMS, ask for help as well to bring an AED. And once this has been done, immediately start chest compression or CPR. Now, with the restriction due to COVID-19, it is highly recommended that you will not do checking of the breathing, or you don't do ventilation or mouth-to-mouth resuscitation, because remember, you don't know what is the reason behind why this person now, who is walking 5 minutes ago and now he is flat on floor. The components of your BLS, number 1 is to ensure safety. It is your safety and your potential patient's safety. Check for the response by simply tapping the shoulder and asking him if he is okay loudly. Number 3, if you think and that person is unresponsive, immediately activate EMS or emergency medical services. Number 4, once you activate EMS, start your chest compression or CPR. Number 5, check airway and ventilate. And lastly, once the defibrillation arrives to the location, immediately hook the patient to defibrillation and provide an early defibrillation. Again, like what I have said earlier, due to the restriction brought by COVID-19, I will advise that do hands-only CPR without ventilation. Now, Another thing that I would like to stress here is the checking of pulse. Okay? Usually in the previous BLS, they do airway, breathing, and circulation. But this time, they changed it to CAB, circulation, airway, and breathing. Now, how you are going to check for pulse? It is very simple. Just peel the Adam's apple. Down the groove of the Adam's apple, there is where you will locate the carotid pulse. You will do checking the pulse in carotid for adult and child. Now, take note of this. When you check for the pulse, always check the pulse closest to you. Do not make your hand check the pulse on the other side. Because with the current technology, people around you might take video of what you are doing, and once this person, unfortunately, God forbids, the CPR that you provided is not that successful and he died, then people might accuse you that the reason why he died is because you strangulate him. So, always check the pulse. If you're confident enough to check it, the pulse always closest to you. But again, I will advise, if you are not a healthcare professional or not confident to do pulse check, the only thing that you can do is to immediately do chest compression. If no pulse, immediately provide 100 to 120 compression per minute. This is the recommendation of the American Heart Organ Association, as well as the International Liaison for Committee on Resuscitation. The recommended depth of compression for adult is at least 2 inches. You need to push fast and hard. It is also the recommended depth for children beyond puberty. Avoid excessive compression or beyond 5 centimeter or 2 inches, because you might damage the rib cage, and that would cause additional or further harm to your potential patient. Now, let us see the adult 1-man, 2-man, and the use of AED CPR. Like what I've said, the first steps is to be safe. Make sure that the scene is safe for you and also for your potential patient. If that incident happened along the road, make sure that you move first the patient to a safe place, and also moving yourself because you don't want to get hit by other car. Secondly, if it happens with the drowning incident, you need to take first the patient out of the water and put him on a flat surface. You cannot do CPR definitely in the water. Above all, make sure that you are not get injured. We don't want to see 2 patients flat on floor. Okay? So your safety is most important. So you need to survey the scene. If the scene is safe for you, then you go and have access to a potential patient. If the scene is unfavorable to you, don't put yourself at risk. Immediately activate emergency medical services. Number 2, once you have an access to the patient, assess the patient. Check his condition simply by shaking that person or tapping his shoulder, and talk to them loudly. Check if that person has breathing. Now, sometimes or most of the time, an ordinary person, they think that the person is breathing, but actually it is not breathing. We call it the agonal breathing. It is only gasping air. The person is not breathing at all. So you need to immediately activate your EMS or send someone to call the emergency medical assistance and tell them to bring you the AED. If you are alone, you can use your hand phone while assessing the breathing or call for help. If you are dealing with adult patient, you can leave the adult for some times and call for help. And you need to return back immediately. Once you activate your EMS, you can start now or begin your chest compression or your CPR. Then, once the AED arrived to the location, immediately hook the patient or your potential patient to AED and provide an early defibrillation. Again and again, considering the current situation with the restriction of COVID-19, hands-only CPR is highly recommended, especially if that person is a stranger to you. Now let us see one-person BLS for adult patient.
If the scene is safe, approach the victim and assess their responsiveness. Send another person to activate the emergency response system and get an AED if possible. Assess breathing and check carotid pulse. If the victim is not breathing or only gasping and has no pulse, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 inches. Open the airway and deliver 2 breaths, each lasting 1 second, and watch for chest rise. Resume compressions. It is important to minimize interruptions in chest compressions to 10 seconds. When the AED is brought to scene, begin by turning the device on. Remove any clothing from the victim and apply the AED pads. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. Open the airway and deliver 2 breaths. Continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives.
Special note with regards to compression of adult, you need to place the heel of your hand at the center of the chest of an adult patient or above the sternum and other hand on top of it. Make sure that your fingers are interlaced, you lock your elbows, and make sure that your hand is perpendicular to your shoulder. By doing this, it will be sure that you will be able to provide a high quality chest compression or CPR. And every chest compression, make sure that you will let the chest to bring back to its normal position or what we call chest recoil. Because if you continuously compressing the patient, like what I've said, the only recommended number of chest compression per minute is 100 to 120 compression per minute. Now, let us review the 2 rescuer BLS or CPR for adult. Same thing with your single rescuer. Of course, both of you need to make sure that the scene is safe for you and to your potential patient. Assess again the injured victim by simply tapping their shoulder and talk to them loudly. Once you identify that they are unresponsive and not breathing, you can activate your emergency medical services. And once you activated it, ask the other person to bring you an AED and you begin CPR. Once AED arrive to the location, immediately hook the patient to the defibrillator or AED so you can provide an early defibrillation. The second rescuer prepares the AED for use, and to begin, you should begin chest compression. You need to count out loud because you need to make sure that you are not get exhausted and you are not escaping the counting. You need to make sure that you are providing 30 compression and 2 ventilation, 5 cycles for 2 minutes. The second rescuer apply the AED pads. The second rescuer also will open the airway of the potential victim. He is responsible for ventilation, wherein your responsibility only as a compressor. After 2 minutes or 5 cycles of chest compression, that's the time that you will switch roles. The one who ventilate will be now the compressor, and the one who compress will be now the ventilator. By doing this, it will avoid easy fatigability for those people who's providing CPR. And then quickly switch between roles. Do not make any interruption when you switch roles. Remember, The quality of CPR that you will provide will identify the success and effectivity of it. So let us see the two-man rescue for adult.
If the scene is safe, approach the victim and assess their responsiveness. Send the other person to activate their emergency response system and get an AED. Assess breathing and check the carotid pulse. If the victim is not breathing or only gasping and has no pulse, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 inches. Open the airway and deliver 2 breaths, each lasting 1 second, and watch for chest rise. Resume compressions. When the AED is brought to scene, the second rescuer should begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one below the right collarbone and the other to the side of the left nipple below the armpit, while the other rescuer continues performing CPR. Plug in the connector and clear the victim while the AED analyzes the rhythm. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR beginning with 30 chest compressions. After the compressions, the second rescuer opens the airway and delivers 2 breaths. Continue CPR at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives. The rescuer should switch roles every 2 minutes or after 5 cycles of CPR.
Now let us see the CPR for adults with the use of AED.
If the scene is safe, approach the victim and assess their responsiveness. Send another person to call 911 and get an AED if possible. If the victim is not breathing or only gasping, begin CPR starting with compressions. Perform 30 compressions at a rate of 100 to 120 compressions per minute at a depth of at least 1/3 the chest. For adults, this is at least 2 inches. Open the airway and deliver 2 breaths, each lasting 1 second, and watch for chest rise. Resume compressions. It is important to minimize interruptions in chest compressions to 10 seconds. When the AED is brought to scene, begin by turning the device on. Remove any clothing from the victim and apply the AED pads, one below the right collarbone and the other to the side of the left nipple below the armpit. Plug in the connector and clear the victim while the AED analyzes the rhythm. If no shock is advised, resume CPR beginning with chest compressions. If a shock is advised, clear the victim again before delivering the shock. Once the AED has charged, hit the shock button. After delivering the shock, resume CPR, beginning with 30 chest compressions. Open the airway and deliver 2 breaths. Continue at this ratio of 30 compressions to 2 breaths until the AED prompts you to stop or further help arrives.
Now let us move with regards to ventilation. I will give you a very brief with adult mouth to mask ventilation only. But like what I've said, it is not highly recommended for you to do so, especially during this current pandemic situation that we really don't know what is the reason behind why this person is flat on floor. If you are alone and you do CPR and you have a pocket mask, so you need to make sure that you are use a protective barrier to avoid any contact directly with the patient, especially if it is a COVID case, so you don't want to have exchange of saliva if you do mouth-to-mouth resuscitation. One of the devices that we use is what we call pocket mask, or you can use your face shield. After doing this, you need to give 30 high-quality chest compression to your patient. After 30 high-quality compression of the patient, you are going to ventilate the patient. If you are using pocket mask, make sure that you seal the mask against the person's face. Okay? And this is what we call the C&E technique. If you can see, the thumb and your index finger will hold the chin on the chin part or the lower part of your pocket mask, and then the other forefinger, which form an E, okay, will be on the top of it to make sure that there is a perfect seal of your when you use your pocket mask or any form of face device to give ventilation.